Dr. Clayton will start off by providing an update on today's cases, and then we will take your questions. I'll turn it over now to Dr. Clayton.
Good morning, everyone. Today we are reporting 33 new cases of COVID-19 in the state. This does include 8 new hospitalizations, as well as and 0 new deaths. The total number of newly recovered individuals includes 87, and we have 1,152 new negative tests that have been performed. This brings our total case count for COVID-19 in the state to 5,067. Of those, 1,015 are active infections, and 3,990 individuals have recovered from the virus. We have 89 individuals who are currently hospitalized and 62 individuals who have died. In total, the total number of negative tests that have been performed include 41,779 individuals. For new cases by county, we have 1 in Beadle, 1 in Brookings, 6 in Brown, 3 in Buffalo, 1 in Charles Mix, 1 in Dewey, 1 in Fall River, 1 in Hutchinson, 1 in Kingsbury, 1 in Lincoln, 1 in Meade, 7 in Minnehaha, 6 in Pennington, 1 in Todd, and 1 in Turner. For new cases by age range, we have 5 in the 0 to 19 year age category, 3 in the 20 to 29 year, 8 in the 30 to 39 year, 10 in the 40 to 49 year, 6 in the 50 to 59 year, 1 in the 60 to 69 year, and none in the other older categories. For new cases by sex, we have 15 that are male and 18 that are female. For updates of our known clusters, we have 135 of 161 Demcota cases that have recovered. For the Jack Links facility, we have 37 out of 84 cases that have recovered. And there are no new updates to the Smithfield cluster data. The one other thing that I would like to mention is an enhancement that was posted to our website today. This will allow for individuals to look at historical data, both statewide and at the county level. I'll just give a brief rundown of some of the highlights. So we have the rate of cases over the past 14 days and the total that are cumulative over time since the beginning of the COVID-19 pandemic in the state. We have another area that shows the 14-day trend data. So this is an update and a replacement of the previous data which we had been publishing out periodically. And this will be updated on a daily basis so that individuals can monitor those trends. The data does differ from what we are reporting out as part of our daily updates. The data that we have published here talk about the positive test date and is delayed by up to 2 days. And so we have we're not representing data more than 2 days previous, or excuse me, we're starting 2 days previous and backward. And the focus here is that the positive test date represents the date that the test was resulted as either positive or negative, and this avoids some of the issues of when those negative test results are getting to us. I think as the media and everyone else is well aware that we do receive the positive test results immediately as they've been resulted from different laboratories. That's part of our the notifiable disease list that we have around SARS coronavirus. And so this helps alleviate any of the differences or fluctuations that we might observe when we're publishing out those negative test results. The last piece that I would like to showcase is just the EpiCurve, which is now out there, which shows both that positive test date as well as the symptom onset date for cases in the state. They're also overlaying that as a 5-day moving average to help smooth out those day-to-day variations in the numbers and show a little bit more fluid trend over time to that data. So hopefully folks will be able to take a look at that and help provide some better awareness of trends and what's going on within your local community within the counties.
All right, I'll go ahead and unmute the lines, and then we'll take your questions.
Good morning, JP at KORN News Radio.
Go ahead, JP.
Thank you very much. I wonder if we could get an update on how the testing is going at the nursing homes and the assisted living facilities, and if we could find out at this point how many positive and negative tests have come out for residents and staff.
JP, this is Kim Alsem-Reisen. Our total numbers tested as of today are 11,532. That is broken out by 4,711 residents and 6,821 staff. We do not yet have the actual totals of numbers, but I can tell you that less than 0.5% have been positive. So they remain very, very low, and for that we are very grateful. And we'll be providing some additional data towards the end of the mass testing events.
Thank you.
You're welcome.
Next question. Any questions?
This is Joseph from the Capital Journal.
Go ahead, Joseph.
Thanks, y'all. Good morning. This is kind of an opinion question kind of answer, open-ended style. Just like, what is both Dr. Clayton and Secretary Kim, ma'am, you know, what's like your guys' opinion on, so there has been a lot of downward, and you know, a lot of me is like proud that we're going down, but is it reflective of, how reflective is it of what is currently going on? Because it's going to continue to spread. We're going to, I would think, continue to see, you know, singled out cases in lots of counties, kind of the way we've been seeing it. I don't think that the numbers will grow because you guys have press, and I think the press has done a pretty okay job at, like, you know, come on everybody, get in the foxhole kind of stuff. But like, what is your opinion of how things are going numbers wise, statewide? Is it kind of going where you think, you know, like where do you see us? Because this is supposed to be the peak right now, and I don't think the peak is going to be in the middle of this month, which is fine. You know, if we can flatten and smush the crap out of it, let's go. Do you know? I'll stop babbling.
Okay, Joseph, thank you. This is Kim Alsem-Reisen, and I'll just again remind folks that the purpose of the prior modeling was really to ensure that we were planning to have enough hospital capacity to, you know, be able to take care of folks. And so the peak was always with that thought in mind. And as you point out, we have flattened that curve mightily, and do not expect to need the 2,200 beds, you know, just in a couple of weeks, which is a great thing. So, you know, I think people are really taking this seriously. I think you know, we're just continuing to learn more about the virus itself, how it spreads. You'll recall in a couple of weeks ago, the definition of a close contact changed. And so a close contact is actually a person who's within 6 feet of a positive person for at least 15 minutes. And so that's a much longer time frame. So that would suggest that the transmissibility looks different than what we were working with here at the beginning of our COVID response. And so, you know, we're going to continue to work extremely hard to ensure that testing is available to anybody that's symptomatic across the state, that we support mass testing where that makes sense with vulnerable populations, that we maintain our track record of investigating cases within the day that we receive them so that we can again, really put COVID in a box. And if we can continue to do that, we're optimistic that we will, be able to manage this very well and minimize its impact on the people of South Dakota.
Next question.
Thanks, Mayor.
Hi, Todd Epp, Kello.com News.
Go ahead, Todd.
Just to set this up a little bit, I was in the middle of the George Floyd protest Sunday, and I'd say probably 70% of the people there were wearing masks, and it was largely a younger crowd. On Friday, I was at a bar and grill in Sioux Falls, and they had outdoor seating, and nobody was wearing a mask, not even the help. How long do you see the social distancing and mask wearing and so forth to go on? I mean, also seeing comments on Facebook and other places where people saying they're done with it. Do you see an end to this anytime soon of those types of precautions?
Todd, this is Kim, and then I'll turn it over to Dr. Clayton. What I would point out is that the recommendations for mask wearing have also changed throughout our time responding to COVID-19, and so there are some different recommendations out there. But nevertheless, it is, it can be something that can help protect people, and so there are some specific times when the CDC would recommend that people wear masks. To your larger question of, when do we ever go back to how things used to be, is obviously trickier to answer. I think our team would say, we're going to be practicing kind of the social distancing and some of the things that are keeping us safe for some time yet. And so I think we need to be, smart about that and continue to use common sense and do what we can do to minimize the spread, and especially around those vulnerable people, because those are the folks that are more likely to get very sick from COVID.
And this is Dr. Clayton. The big focus, I think, around this has to be, how can individuals, still have some normalcy, during the time, and I will say during, we are not post-pandemic, during the time of COVID-19. And, that's going to be as best we're able in various settings, in group settings, maintaining that social distancing of greater than 6 feet, decreasing that direct contact time with individuals to less than 15 minutes, and use of cloth face covering for decreasing the risk of those respiratory droplets to be transmitted from an infected person to somebody who is susceptible to the virus. And that is something that is going to continue for the foreseeable future. We anticipate seeing activity related to COVID-19 illnesses and hospitalizations through the summer, and then into the fall when we start also with influenza and other respiratory pathogens that make it much more difficult to identify what the person's fever and cough, shortness of breath might be associated with. So I do not see this as a short-term concern. I think, there is an understanding that individuals need to maintain those precautions, and there is a full understanding that individuals, are tired of doing so. This is not our normal, but it is our new normal.
Next question. Final call for a question.
Kelly Hertz from the Preston Dakotan.
Go ahead.
I've seen some reports about concerns in some medical journals about pediatric inflammatory syndrome connected to this among younger people. Are we seeing any of that in South Dakota, or is there any concern of that or any planning on that so far?
So we are aware, and there is a case definition that we use to evaluate individuals who might be considered suspect for that multi-inflammatory syndrome, and so we do have and continue to ask for clinicians to report suspect cases to us for evaluation. At this time, we do not have any of those cases that have met CDC case definition. But we do continue to push out information to the medical community as we have information that comes to us from CDC.
All right. Thank you all for joining us today, and we'll visit with you tomorrow.